Hi, I am Dr. Pankaj Yadav. I am consultant Pediatrics and Neonatology at Cloudnine, Golf Course Road, Gurugram. How do I know whether my baby is having any chest infection? So generally, you will come to know by looking at the symptoms. What are the common symptoms that occur in chest infection? They can be running nose. You can see that there is stuffy nose. There is noisy breathing. When the baby is breathing, baby is uncomfortable, irritability. There may be poor feeding. There may be some fast breathing, that baby is breathing very fast. Or you can see sometimes baby have fever. So these are the common symptoms that you will come across while the baby is having chest infection. So if you see any of these, you have to visit your doctor. So the doctor will be doing a thorough examination from head to toe, in which generally we look for the signs which are related with the chest infection. So common signs are like baby is having fast breathing. Normal rate of breathing is around 40 to 60. But if the baby is having more than 60 breaths per minute, that is called fast breathing. Also, the doctor will examine, generally we look for any accessory muscles, whether they are acting. So we do see sometimes there is indrawing of the chest, whether there is some retractions are there. We also look for the nasal flaring. Sometimes there will be accessory muscles which are acting. So these are examined. Then next comes the auscultation. So it is very important that the doctor examine with a stethoscope, and that is a clinical diagnosis, and they will clearly get to know whether there is some chest infection or not. And in very rare, very few cases where it is very high fever and is not responding with common medicines, and if you feel there is some pneumonia inside the chest, the doctor may ask you for going for an X-ray, but that is very relatively very few cases that we have to do a X-ray get done for this. So mostly it is a clinical diagnosis, and just by examining and based on the symptoms we can properly evaluate whether the baby is having any chest infection or not, and accordingly it is treated.